Today we will talk, how to take history of patient, when presenting complaint is ankle swelling. Start by asking about distribution. Ask to the patient, is this swelling is on both sides? Remember, symmetrical swelling may be due to congestive cardiac failure, cor pulmonale, nephrotic syndrome, hypoalbuminemia, chronic liver disease, hypothyroidism, or sometimes due to drugs. Then ask about extent. How far up legs does the swelling extends? Ask about swelling in any other part of body. Next question. In which part of body you noticed swelling initially? Ask about swelling in groin area. Ask, when did the swelling started? It is important to ask, is this progressive or intermittent? Then, ask about nature of swelling, that is, pitting or non-pitting type. Ask about aggravating factors. Dependent edema due to venous insufficiency worsens at the end of the day. Patient may say, that edema developed after use of antihypertensive drugs. As amlodipine can cause edema, you know well. Next, ask, how this swelling improve? Dependent edema is improved by leg elevation or by compression stocking. Patient may say, that his swelling improves after use of diuretics. Ask about associated factors like, is there any weeping or oozing from swelling? Next, ask about skin discoloration. Now, this is time for differential diagnosis. Ask about shortness of breath, orthopnea, paroxysmal nocturnal dyspnea, and chest pain on exertion to find out cardiac cause of edema. Cor pulmonale. Ask about smoking, chronic cough, sputum production along with shortness of breath. Next, chronic liver disease. Ask about previous history of jaundice, abdominal swelling, black loose stools, and vomit of blood. Next comes nephrotic syndrome. Ask about sore throat, skin infection before development of swelling. Ask about nausea, vomiting and itching. Question about urine. Inquire about quantity and color of urine and also ask about frothing in it. Next, ask about weight gain, constipation, cold intolerance and inquire about goiter, to rule out hypothyroidism. In systemic review. Ask about joint pains and swelling, facial rash. Ask about abdominal pain, weight loss, anorexia, or lumps in body and change in bowel habits, as extrinsic venous compression may cause ankle edema. In medication history, ask about previous medications before development of swelling. Ask about use of Hakim and herbal medications. We hope this video will help you while preparing for exams. Subscribe our channel for next coming videos.